Hi everyone, it's Barbara Phillips, nurse practitioner, and we're back with another NPBO Business Question of the Week. And this week we're going to be talking about the feasibility of a mobile practice. So the NP today is asking, I would like to start a mobile practice that visits certain job sites each week. Eventually, she wants to expand to either a brick and mortar site or having a mobile RV that patients can use for more privacy because she wants to do things like women's health exams. She'd like to be able to take insurance and self-pay, and she wants to know, is this something that sounds feasible, and will insurance companies reimburse for primary care services rendered outside of a clinic? And so there's a lot of questions here, but let's see if we can break it down. I really like this question because this is something that every single business owner should be doing before they ever do anything. It needs to work on a piece of paper, and this is that planning process. So I congratulate whoever wrote this question because it is crucial to your success. So let's look at some of those questions though. Insurance policies. Will insurance pay for this? Well, policies vary from place to place and policy to policy. So you can have somebody that has a Blue Cross coverage and their policy may say, yes, we'll do this, and another policy will say no. So you really have to look at the policies that are involved. But let's take a step back here. You're talking about visiting small businesses, and depending on the size of the business, they may not offer their employees healthcare coverage because of the cost. They may not be able to do that. So there's a couple of different things to consider. First of all, if they can do healthcare coverage, it may be one of those high deductible plans, which is fine, but what will happen then is either the employee will end up paying out of pocket until they reach that deductible, which isn't likely for your healthier people, or perhaps they have a health savings account or a flexible spending account that is associated with their coverage, and they could use that to pay for care. Now, the other thing is too, businesses may pay you to come out and see their employees because it's really a win-win situation. First of all, perhaps with these kinds of services that they can pay for at a quite of a discount savings, they may be able to just pay you directly. That allows them to still give coverage to their employees, but then they can also have the back end coverage of those high-end deductible plans. So that's one thing. The other thing is if you are providing services in a place of business, well, then the employee doesn't have to leave work. There's going to be less absenteeism, less disruption during the day when that person is trying to get some work done. So that's something to consider as well. Now, what about really the feasibility of all of this? Well, this is when you really need to look at what is your overhead going to do. So if you're getting a mobile RV, for instance, you need to include all of the costs associated with that. If you're just using a vehicle, you certainly need to include all the costs associated with that. What kind of overhead do you have? Do you have any staff? What about your insurance costs? What about supplies that you need, and how are you going to get them to that place? All of your marketing, all of your administrative time, your billing time, etc., has to go into your overhead. There's a huge list of what you would want to include in overhead for your practice. Then the other thing you need to look at is, what about revenue generation? This includes your insurance coverage. It includes then not just what the insurance company gives you, but don't forget all of those copay, co-insurance, and deductibles. Those are important for you to be gathering as well, because that's becoming a larger part of our revenue in our practices. What are you going to be charging for cash practices? Start doing some market research in your area and figure out what some going rates are, and then how you would want to fit in with that. The bottom line is you have to make sure that you are seeing enough people to meet your overhead costs and to create the income that you want as you move forward in your practice. I think this is a great idea. I think we'll be seeing more and more of this kind of thing. So, and again, I'm really glad that you asked this question because it doesn't get asked enough. So if you have questions or comments on this episode, just leave them below this video. Or if you have a question, you can go ahead and send it to us over at bit.ly/NPQuest, or you can send an email to us at npbohelp@gmail.com. I highly encourage that you visit our blog at npbusiness.org. We've been publishing that for over 10 years, and it has lots of tips and questions that people have been asking. Plus, you can find out more information about our services at Clinician Business Institute. Please like this video, subscribe to our video, share it with your colleagues, and you can also connect with us on any of the other social media platforms. Just look for NP Business or me, Barbara C. Phillips. And thank you so much for taking the time to watch this video, and I will see you next time. Bye-bye now.